Welcome to the American College of Surgeons Bulletin Brief from the front line, Surgeons' Voices. With me today is my friend and fellow colorectal surgeon, Dr. Clifford Coe. Dr. Coe is known to people around the world as the director of the Division of Research and Optimal Care at the American College of Surgeons. Welcome, Cliff.
Thanks very much. Thanks very much for having me.
Well, it's great to chat with you about our upcoming July 12th to 16th, 2021 annual Quality and Safety Conference and second annual virtual Quality and Safety Conference. So perhaps that's a good starting point. The Quality and Safety Conference began years back as the NISQIP conference and gradually grew and evolved, and then suddenly became, like, as did all conferences, virtual. Maybe you could tell us a little bit about the development and transition of the conference.
Sure. So would be happy to. The conference started over a decade ago for NISQIP hospitals, and it was a time for all the surgeon champions and SCRs and people involved with NISQIP to meet in person to go over the reports and share best practices and their barriers and limitations and challenges and how to do quality improvement. And that grew as NISQIP grew. That conference grew from hundreds of people to thousands of people. And then we had an idea that, all right, well, if we're the College of Surgeons and we have so many different quality improvement programs, why don't we have everyone come in person? And that's when we renamed it the Quality Safety Conference. So now basically we have everyone from all the different types of programs we have at the college coming together. And when it was live, it was terrific. It had couple thousand at least people coming together talking about quality and the core pieces, and then each of the quality programs had their own individual sessions to talk about cancer and bariatric and so forth. And then last year with the pandemic, we transitioned to the next iteration of having it virtual, as many people know, and from a lot of different conferences. And lo and behold, our registration went up to 10,000. We had people from 100 different countries, which was terrific. And then suddenly it really became a global conference, and we were very excited. And it's more of the same this year with the virtual conference.
Well, great. And I know the conference, when it was live, had multiple parallel tracks that, as you mentioned, people could go to the bariatric track or the cancer track or the trauma track or what have you. Or there were many sessions that were geared at everybody that taught about things just like measuring quality, for example, and assessment tools and things like that. How is it going to be structured as a virtual conference? Is there going to be one channel or multiple simultaneous programs?
Yeah, so we are always trying to iterate and improve, and so this year we have multiple sessions that are simultaneous. We have sessions that are pre-recorded, and we're going to have sessions that are live. I think a lot of people appreciate the live interaction. Different than last year is that last year we had sessions released each day, each hour, and figuring it's almost like a live meeting where you kind of go attend one session and the next hour there's a different set of things that are available. This year we're kind of going along the lines of maybe YouTube, where on 8 a.m. Monday morning, a whole bunch of things are going to be released. So if you want to watch a whole bunch of things and put it in your queue, you don't have to wait for a certain day, a certain time. There's a whole bunch of things that's going to be released. Not everything. There are some things that are going to be scheduled for each of the days, each of the times, but the vast majority of the content is going to be released 8 a.m. Monday morning, and people will have at it and watch basically a whole bunch of stuff immediately and put it in their queue, just like they would, watching videos on the internet.
That's great. Now, one of the nice things about the playlist, and many people commented on this aspect, which they appreciated from the annual clinical congress last October, was the ability to go back and look at content after the meeting, which obviates the problem in a live meeting, parallel sessions. The good and the bad. The bad, you don't get to go somewhere and be with your friends and spend some time together, have a meal together. But the good is you don't have to pick which session, because you're not saying, I'd like to hear that, but I'd also like to hear that, because you can go back to it. How will that function work this year?
Yeah, so I think it's going to be the same thing as clinical congress. There's going to be, as even when the quality and safety conference is finished, there's going to be everything that's on demand, which is terrific because there are over 90 sessions. There's over 450 abstracts. Largely are the quality improvement efforts at individual hospitals that are presenting in abstract format. There are almost 300 speakers. So afterwards, on demand, folks will get to watch all of that stuff, all of that material.
That's fantastic. Do you know for what period of time the content will remain available?
Yeah, I think we're going to keep it open for 2 months. And then we'll see if a lot of people are still watching it. We'll probably extend it. But I think for most conferences, most people watch it within the 2 month time frame.
The other point of the Quality and Safety Conference that is perhaps a bit different than leadership and advocacy and different than the annual clinical congress is the composition of attendees. And you alluded to it a bit earlier. It's not just surgeons. And you mentioned some of the other groups. What proportion of the attendees would you anticipate are surgeons versus other people who are in the quality realm?
Yeah, great question. And it has changed over the years. It used to be less than 50% were surgeons, and the majority of people were non surgeons, nurses, quality improvement people, hospital leadership. As more and more surgeons have started to do quality more formally, as residents have to do their quality improvement projects each year for the ACGME, the percent of surgeons has gone up. So now it's probably about two-thirds surgeon, one-third non-surgeons, being made up of other physicians, anesthesiologists, other specialists. With our geriatric program, we have geriatricians attending. With our bariatric program, we have other folks who are MDs, non-surgeons, that are part of that program. Obviously, in cancer, the different cancer doctors, but we also have nurses and quality improvement specialists who are just, that's their main role, is doing quality improvement. And so probably about a third of the people who attend are non-surgeons.
Well, as surgeons, we're used to measuring and being assessed and accredited, and we like to put our certificates on the wall from, from NISQIP and COC and NAPRC and the rest of it. But there are other facets of the quality and safety programs that don't involve accreditation programs, and they're, perhaps a bit behind the scenes, unless you're a researcher involved in running programs, such as the AJCC, such as the NCDB, maybe the National Trauma Data Bank. Is there exposure for those types of programs as well?
Absolutely. So the cancer programs and some of the ones that you're alluding to, of the staging of the databases, and the college has 7 different databases. So there are aspects just about the data pieces of the variables, the analytics, the changing of how we do modeling and risk adjustment. So there are absolute sessions targeted to those aspects as well. There are other programs like Strong for Surgery, that is a preoperative readiness program. There's Thrive, which is the value-based program that we're launching probably later this year, that talk about how to, if you're going to be in a bundled care program, how to set yourself up to optimize that and do well in that. And so not just the accreditation or verification programs, but there's a lot of the different quality programs that the college has that we will talk about. And also a lot of the programs that we have that we're piloting right now. We will probably launch 5 or so programs by the year's end, or maybe in the next 9 months. And so we're going to start to really tell people about these programs and some things that we're actually launching at the conference.
Yeah, we were very pleased to be able to go through the QVP visit and learned a lot from it, found it a valuable experience. And I remember from a couple of years back, I think it was the Washington, D.C. live meeting of quality and safety, when you were talking about some of the new programs in your address, which was a very enthusiastic address, I might add. Enjoyed it immensely. Good style.
Yeah, I think this year at the welcome, I'll kind of introduce some new programs that we're going to be launching at the conference, as well as the next several months. So stay tuned.
So we'll stay tuned, but let's have a little sneak preview. All of the major networks and movie producers do that. A little glimpse. Give us perhaps a few sessions that we could really look forward to.
So I think that, In this day and age, it's very important that we have some pieces about wellness. I think that you and I are working on some things at the college and so with some other experts on wellness, and there are some sessions targeting that. Uh, for diversity, equity, and inclusion, there are some really outstanding sessions on that. There are some sessions on quality improvement, core aspects of quality improvement, and we're going to release a course for individuals to get certified in surgical quality improvement. And we're starting to have some sessions that's led by a group of people who are very experienced in surgical quality improvement education. And that's going to be released at the conference. And then the course will be explained and then released right after the conference. But a lot of the materials will be in the conference as well. So those are some, I think, highlights, but there's a lot of others as well.
It sounds like another fantastic program. I'm very much looking forward to benefiting from many of the sessions, and happy that I can see a lot of them after it ends. So I can just kind of keep watching when I have a bit of spare time. That's the luxury of this format. Any parting words before we bid adieu?
I think that the Quality and Safety Conference is one of the conferences that no matter what specialty you're in, what level you're in, what role you play on the surgical team, that there's something very relevant and very meaningful for the job we do every single day in taking care of patients. So join, kind of look at the program, see what interests you, and let us know what you think.
Well, thanks so much. And you've done a great job with quality and safety. I always enjoy your reports at the Regents meeting. I enjoy this annual conference. And I thank you not only for your time and insights today, but your wisdom and leadership throughout the year, every year, ensuring that the ACS is at the forefront of quality and safety in surgery throughout the world.
Well, thanks very much. Thanks for giving me some time. Thanks.